For the longest time, we have wrestled with the dichotomy of our school being a professional school, where students not only need to learn in the classroom, but need to learn in the clinical care environment and in the research environment. And yet our IT systems and our IT infrastructure didn't support that unified development. My name is Rajesh Mangrulkar. I serve as the Associate Dean for Medical Student Education here at the University of Michigan Medical School.
Literally everyone who has used a computer sits in front of an electronic health record and go, wow, I can do this better. And everyone, pretty much gets frustrated. The problem is you wish you had access to data that you just simply don't have. My name is Rich Medlin. I am in the Department of Emergency Medicine at the University of Michigan. I am a board-certified emergency physician and also a board-certified clinical informatician.
My experience from working directly with faculty and staff is that everyone has that universal sort of experience. And it's very frustrating if you don't understand how the medical record works. My name is Paresh Patel. I'm a child and adolescent psychiatrist and faculty director for the MiChart research team.
Because we see such complicated patients with such rare diseases at the University of Michigan, it is frequent that there's simply no papers published on what the right course of action is. And so one of the things that would be nice to do is have we ever seen any of these patients? What happened to them? This is what's called a point of care clinical trial. And from a computer science standpoint, it's incredibly complicated, but that's what everybody wants.
If I was a learner in this space, I would be incredibly frustrated of having to switch and try to learn different things based on what role I'm playing on a given day.
5 years ago, you would think about a study with 100 subjects or 1,000 subjects as maybe a reasonable study. Now we think of studies with 10,000, 100,000, and even greater. And that's only possible because of the ability to move data more quickly, the fact that a lot of the data is entered in sort of structured format. It's painful, and people, I think, bristle a little bit around that, but it also is an important step in moving the field to the point where we can extract more useful data.
Technology is really an incredibly supportive function of what we do, and it's also a really key enabler to try and do better things.
I think there are lots of smart people in data science and machine learning. If they have access to the data, they will likely discover lots of things that would not be perceivable to a human researcher and uncover lots of interesting associations that need research.
At the University of Michigan, and like most other big institutions, there's an electronic data management system for managing clinical trials for research. The electronic medical record was never built for that purpose. That system plays a huge role. It allows all the clinical trials to be entered, monitored, data collected to be entered in there, adverse events to be recorded. It's a big project, and it needs to integrate efficiently with Epic in order for it to work. MSIS and MCIT partnered to prototype a working mobile device data collection system. So it's now possible to collect, for instance, your weight, your blood pressure, other basic indices from home. It's really very useful if you were monitoring patients' diabetes and health status, and also as a feedback mechanism for patients to motivate themselves for change.
We used to have to do our computation in one world and then go and do in another world. But here, now IT can transform the way we interact with individuals, transform the way we conduct an experiment, whether it be through database or through a clinical trial or through basic science. We can bring the technology right to the place where we're doing the work and transform the way that we do our work.
On a typical day, I am usually digging into the data that is coming out of Epic. With the assistance of both MSIS and MCIT, I've created some data flows for the emergency department, including real-time status of patients in the emergency department, and a data barn for the Department of Emergency Medicine to allow ad hoc querying by clinicians and researchers.
The unification process, I think, is going to be really important and really helpful because it's going to allow us to bring all that under an umbrella. So we have a streamlined process for identifying who needs to be contacted, what governance bodies need to make decisions, what are the important next steps, and whether or not we're going to invest in those.
But the thing that I think IT can become, that it hasn't been as much in the educational space, but we're starting to see the beginnings of, is IT as a driver of new educational methods. Examples include simulation, virtual dissection. That's a way that IT is really transforming the way we interact.
The ability to have a single point of contact, a single group of experts, is going to make things just wildly more efficient in the future.
It will become seamless when a student moves between those different settings, and they can learn, have great learning experiences through the use of technologies in all of those settings.
I can't really predict what great ideas are going to come out in the next 5 years, much less in the next 5 days. But I'd like to see a system that's flexible enough to meet that need.
So in 5 years, I think our work is fundamentally different. Our education is fundamentally different because of IT. Not just because IT supports it, but because it can help us change it the way we want it to be changed.